Magandang umaga, buenos dias, maayong buntag, Zamboanga Peninsula. Welcome sa Kapihan sa Rehiyon, Nueve. Hatid sa inyo ng Philippine Information Agency, Region 9. Ang programang ito ay isang plataporma para sa mga ahensya ng gobyerno upang ilahad ang kanilang mga programa at serbisyo sa taong bayan. Sa ating episode ngayong araw, makakasama natin ang Commission on Population and Development o CPD. Ating pag-uusapan ang kasalukuyang sitwasyon ng populasyon sa Zamboanga Peninsula at paano nakakaapekto dito ang teenage pregnancy. Pero bago natin ipakilala ang ating panauhin ngayong umaga, inaanyayahan namin kayo na tumutok sa ating live stream sa PIA Western Mindanao, cross-posted sa mga Facebook pages ng Pagadian and Zamboanga del Sur Media. Nakahook up din po tayo sa Radyo Pilipinas. We would like to acknowledge, of course, our online viewers and media partners mula sa iba't ibang panig ng rehiyon. Magandang umaga po sa inyo. At this point, let us welcome our resource person for today's episode. We have Director Leticia Dolores II, C. Abao, the Regional Director of CPD Region 9. Good morning, ma'am.
Good morning, Sir Eman, and good morning to all our viewers sa ating Kapihan sa PIA. It's my first time to be here and I'm glad that PIA also invited us to share about CPD. Actually, Sir Eman, ang CPD or Commission on Population and Development is actually an agency na familiar ang tao nung una pa man. Kasi ang pangalan nito ay POPCOM. Yes. Commission on Population. Mm-hmm. So, nag-start ito na nag-iba starting pre-pandemic time when we were attached under development, DepDev, formerly NEDA now. So, ano ang pagkakaiba sa transition sa aming name? Aside from POPCOM, from the nomenclature na change of name, that would be POPCOM, now Commission on Population and Development. So, una, kinakabit ang word na development, which is not apparent in the previous name of CPD. And why is that so? Kasi nakikita ng ating ahensya and even the government, the Philippine government as a whole, that our population is always increasing.
Oh.
And with that increase, although during that time, POPCOM is still part of the DOH, the focus was mostly on services. Family planning services talaga, no? At saka nagbibigay ng commodities tayo. We are steering the demand generation of the use of family planning, reproductive health. Of course, meron na rin yung adolescents natin na mga programa. But this time that it has already changed, the way the government views the relationship between population and development, this is very, very crucial. Na kailangan mong i-manage ang ating populasyon so that we can not only be growing as a nation, but making sure we grow as a healthy, resilient, and of course, very important, enabled people. And when we were attached now, from Department of Health to DepDev, formerly NEDA, that's the time that we actually being changed in terms of our name, no, from POPCOM to CPD.
Oh, isang taon na ba mula nang
Hindi,
nagbago?
it started around 2018. So pre-pandemic,
matagal na. Yes, matagal na. Okay.
Oh, siguro ang pag-usad lang was a little bit slower because of the fact that the development of our framework during that time, the PPD POA, was still created very recently. Kasi hinahanap yung ano ba talaga ang focus ngayon ni CPD.
Yes.
Right? Kasi nung una, doon tayo sa demand generation, doon tayo sa services. Ngayon, iba na. We are now enablers towards sustainable development. And that's the reason why talagang it would entail us to be under not anymore sa Department of Health, but under the DepDev.
Yes. And we are very happy to have with us Director Leti ngayon.
Yeah,
Kasi nga,
thank you.
bago lang din siya dito sa Region 9. She
Yes,
came from Region 10. Please introduce yourself a little bit para alam
Yeah.
naman ng ating mga viewers
Okay po, sige po. Thank you for asking that, Sir Eman. I'm Leticia. My nickname is Little. I came from...
Little.
Yes, very
Okay.
small.
Director Little?
Yes, I like that. And I came from the Department of Health as a former planning officer. So medyo hindi ako... how do I coin this? I am not really that new to the POPCOM CPD name. Kasi nung time na nasa DOH ako, ang POPCOM po ay attached natin sa DOH. So talagang partner na namin ang Commission on Population. Until such time na nag-DepDev na po ang CPD, medyo nawala na sa ere, sa aming attached agency ang CPD sa DOH. So that's the time that we were also at our level, we're looking at the changes of the role, the mandate of CPD towards sustainable development. So I came from the DOH, more than 10 years po akong planning officer.
Wow.
Opo. And then isa akong environmental planner.
Environmental
Yes
planner.
po. At the
Okay.
same time, I'm a licensed teacher. So nakapag-teach po ako ng mga bata in the past. But now I'm only, tutoring my children as part of our advocacy to make sure that our kids will also be, growing up to be healthy and resilient and intelligent people of our community.
Oo nga naman. Now, going to our topic, na-mention
Yes.
ko kanina kasi nga, pag-uusapan natin, ano nga ba yung current status ng population natin dito sa Zamboanga Peninsula?
Yes,
Director
that's a
Lito?
very, very interesting question. Right now, based on the population, the census for 2024, ang PSA po ay nagpalabas ng count natin. And based on the data or datos natin, nakikita natin that at the regional level, we are having a population growth of around 0.42%. That's from 2020 to 2024. That is basically, kung titingnan mo, slower na siya. Notably
Yes.
slower compared to 1.39 in the previous years. That's 2015 to 2020. So it's a good thing. But we are increasing in terms of our population at 3.8 right now million based on the 2024 census. It also mirrors, Sir Eman, the national population, wherein we had a 0.08 growth rate. Mean to say, tumataas pa rin ang populasyon ng ating bansa, the same with other regions, but it's gradually declining in terms of its growth. Yung paunti-unti. And that's a good thing. Because if you're not going to manage our population, maraming consequences ito, impact sa atin, sa komunidad, at sa tao in general. Now, we look at the population naman in terms of the adolescents, no? Isa sa ating mga concerns, population concerns natin at dynamics natin, itong marami tayong adolescents na nabubuntis.
Yun. Oo.
Oh, nabubuntis. Especially, these are adolescents 15 to 19 years old and below 15 years old.
Yun ang nakakatakot.
Yes, because it will always have impact towards our economy.
Exactly po.
Right? And then also at the same time, itong mga kabataan natin na nabubuntis na wala sa plano, lahat ng opportunities nila ay mawawala sa kanila. So we talk about the numbers, right?
Yes.
In terms of our live births in 2023, our registered live births by age group of 15 to 19 years old, ang account natin dito based on PSA is 13% of the total live births ay nanggagaling sa mga kabataan 15 to 19 years old.
Oh.
71% on the other hand coming from 20 to 34 years old. So okay na yun kasi those are already adult, matured, working individuals. And they can already provide for their family. But these adolescents, 15 to 19 and below 15, medyo nakakalula siya. And looking at the numbers, we're talking about, although there is a decrease from 17,158 in 2022 to 6,835 in 2023, there is a decrease there. But when you talk about live births at 6,800 plus, it's still alarming, right, Sir
Yes,
Eman?
oo. Exactly.
At the same time, to add to that, ang ating under 15 po ay nag-i-increase. Lahat, that's the trend, the increasing trend in our region. Especially that, as DOH reported in our last meeting, na meron silang na-record na 9-year-old
Yun lang.
na napuntis.
Very young.
Very young. It's not even an adolescent yet.
Kaya nga eh.
Bata pa yan at 9 years old. So, that's very, very alarming. When there is an increase, kung titingnan mo ang numero natin, ang datos natin, that's around 118 in 2021, naging 152 ito, live births. We're talking about live births from under 15 natin na age group. It's really, really alarming. That's why we have to do something with these population issues and concerns and how this affects the family, the community, and the country.
Based on sa na-mention po ninyo, in 9 years old na na-record ni DOH, no, marami po bang ganitong mga age bracket no, hindi pa adolescent pero nabubuntis na?
Yes po, based on our data. Because if you look at only the live births, with the increase from 2021 to 2023, marami na siya. Now, meron pang nagsasabi na hindi officially documented pa during the meeting was that although there was a recorded 9-year-old, meron ring lower than that.
Oh my God. Yun.
Yan. But because we still have to look for and verify for this data, kasi
Correct.
this were reported by LGUs, we need to make sure that, this data as presented to us and as reported to CPD and during our meeting should be, a reliable source of data and fact for us to do interventions.
Correct.
That's why importante ang role ng Commission on Population and Development and our partners like Department of Health, our Department of Education, our TESDA at the same time, para kailangan nating mag-collaborate as one
Collaboration.
whole of nation approach,
Yun.
how to address and reduce adolescent pregnancies.
Yes. Based on your data po, can we point out kung saang area specific dito sa Region 9 yung may pinakalaganap yung teenage pregnancy na sinasabi natin?
Yeah.
Pregnancy at 15 to 19 or even
Yeah.
bababa pa?
Yes. Based on the data,
Mhm.
this is coming from the PSA CRVS. So we have
Okay.
the data for our registered live births from 2020 to 2023. We have Zamboanga del Sur and Zamboanga del Norte. Provinces shows an increase in live births. This would be under 15 years old.
Oh my God.
So marami dito ang na-reported na kaso sa mga pregnant na mga babae na less than 15 years old. No? But in Zamboanga Sibugay naman at Zamboanga Sibugay, medyo nag-decrease siya ng konti. In terms of cities naman, ang nag-increase sa atin would be the Dipolog. Medyo mataas siya in terms of comparing it to other cities like Zamboanga City, Isabela, and Pagadian. Kasi medyo decrease ang kanilang na-register na datos in terms of live birth. So there are areas na marami siya compared to others, but generally speaking, the region has an increasing trend. And if you look at another data from National Demographic Health Survey, makikita natin na by in 2023, if I'm not mistaken, na datos natin na NDHS, makikita na Region 9, Zamboanga Peninsula, is at 7%
Oh.
higher in terms of teenage pregnancy proportion comparing it to other regions. Ang pinaka-highest po natin ay nasa Northern Mindanao, which is at around 11%. So we're actually almost halfway. So kung titingnan mo in terms of population and size, that's 3.8 million, and comparing that to our adolescent pregnant, so mataas pa rin ang ating trending na nag-increase tayo.
Yun. I want to dig deeper into this
Yes po.
data po. Ano ba yung pinaka-reason? Why do teenagers, mga teens natin, mga adolescents natin, go into premarital sex? Ano ba yung nag-i-influence sa kanila? Ano ba yung very cause ng teenage pregnancy?
That's a very good question. We cannot, kami from CPD, we cannot just assume. No? We
Yes,
base it on the
yes.
data, base it on the facts. So we have varied data sources. We have the census, we have the CRVS, we have the POPSEN, meron tayo sa DOH, FHSIS. But in the latest data on NDHS and the YAPS, which is really very, very legit in terms of providing us official data sets, these were categorized. These are actually the categories why there is an increase trend of adolescent pregnancy, not only in the region, but nationwide ito. No? Parang bakit siya laganap? Number one is socio-economic disadvantages.
Yun.
It was identified in that report, in these documents, the YAFs and the NDHS, that 10.3% of these adolescent pregnancies are coming from the poorest households. And take note, Sir Eman, alam naman natin, Region 9 posted the highest in terms of poverty incidence.
Yes.
And isa sa ating probinsya na medyo mataas, pero nag-improve naman, is itong Zamboanga del Norte. That's why when we had a chance to visit Governor Darrell, we really emphasize and advocate for really interventions, especially in the increasing cases. Kasi maraming poorest in that province. And generally, the region, that's Zampen. That's number one. So kung poorest ka, you were not able to avail of the services, that's 2. Hindi ka pa nakapagtapos, that's 3. Wala kang information na accurate quality about the services, reproductive health services that we provide in the teen centers and in the schools. And the parents doesn't have, the ability to communicate with the kids about adolescent and reproductive health. Ito ay isa sa mga factors na talagang naiisipan ng mga adolescents to initiate early sexual, activities. So, number 1 yun,
Yes.
yung poverty incidence. Ito, yung sinabi ko kanina, limited education and school engagement. Sa datos natin, that's 19.1% of primary education only. So, maraming nag-engage into these activities, the sexual activities,
Yes.
during primary school. When we talk about primary school, that's graders. Right? No? So, i-compare mo yan sa mga high school, mas na-delay. I'm referring to, college. Na-delay ito. Pero yung mga graders to high school, that's the basic education, medyo because siguro of the curiosity, the peer pressure, etc. That's why they are engaging in these activities. No? Third is low sexual reproductive health, yung sinabi ko.
Yeah.
Kulang. Saan sila nagre-rely? YouTube, social media, no? And we do have varied naman sana ng mga teen centers and health facilities wherein they can avail of this counseling.
Correct.
Right? That's why we need to saturate lahat ng probinsya natin at municipality na meron talaga tayong teen centers wherein they can avail adolescent-friendly na mga services, including counseling. And of course, gender and relationship dynamics. Ito po ay apparent in Region 9. Isa sa mga nakita nating datos na ang mga partners when they got married, itong mga babae natin na mga adolescents, mga teenagers po, ang kanilang partner based on the data on civil registry and the marriage licenses, na 10 years onwards, yung partner nila na lalaki. So makikita natin ang dynamics ng relationship. And perhaps siguro there is a possibility, just a possibility that because the other partner is, older in terms of age, there is always a power imbalance. And the possibility of abuse, and later on, the consent.
Correct.
Pwede yon, no? Kasi bata pa yung bae, no? And of course, the last one is the sources. Yung sinasabi ko, saan bang platform makikita natin na merong eksakto, dekalidad, at magandang advokasya in terms of delaying sexual activities.
Can you do that?
Yes, actually we are doing that.
Okay.
We are CPDs doing that. And we partner with other agencies, the Department of Health, and our partners, the local government units.
Yes.
However, we need to identify, Sir Eman, that while we are doing so, we have to also consider that there is already a devolution in terms of our capacity.
Yes.
So,
Limited lang
lang tayo,
Yes.
right? In our full devolution na executive order, si LGU na ito. So, ang role natin is enabling the service providers through capacity building, trainings, and any other capacity development activities para sila naman ang mag-engage, ang mag-implement that at the level of the local government units.
So you are saying, ma'am, that you have already presented these data sa ating mga local government units.
Yes,
Itong mga
po.
na-mention natin lahat. And they are already aware that these issues are already existing in their respective AORs.
Yes, Sir Eman. When I started my journey as a CPD director here, one of my mandate is to make sure that our governors and mayors would know what is the population and the population dynamics and the demographic, data that they have to know for the province and for the city. Kailangan yon. And that is part of my role as a CPD director. So it's not only giving them what's happening, giving them the data sets, but also informing them and capacitating them. Nga these are some of the interventions in which we can provide for our LGUs and service providers. One instance is the establishment of our community health centers, teen centers, wherein lahat ng mga youth, pag sila ay empowered, pag alam nila, pumupunta na lang sila dito to avail of the services. Di na kailangan magpunta pa sa mga friends nila, mga gintoy, no? Wherein ang tendency nila, there would be peer pressure and their inability to decide will also come in.
Yeah.
Therefore, they will engage with this kind of activities. But if they are counseled, they are having conversations with adults like us, counselors and teachers in the schools and in the community, that could also be an important factor that they would delay their initiation in terms of sexual activities.
Pero iyang na-mention po ninyo are iilan lamang sa mga intervention na
Yes.
ginagawa natin. Before we go, we focus more on the intervention. Ano nga ba yung nagiging resulta in terms of our physical, mental, emotional, dun sa mga kabataan na who engages in, dito, teenage pregnancy? Ano ba yung nagiging epekto nito para sa kanila?
Yeah, there are actually varied impacts or
Yes.
consequences. We can talk about physical,
Yes.
we can talk about mental, we can talk about
Emotional. Yeah.
psychosocial, etc. But we start with, for example, the basic example na binigay ko kanina, 9-year-old getting pregnant.
Yes.
Yan na lang titingnan natin kasi ang trend ng Region 9, tumataas talaga ang below 15 years old. That includes 9-year-old. So ang tendency, 9-year-old that is still a child. And then when that girl becomes pregnant, physically, hindi pa ready yung reproductive niya.
Correct.
Right?
Oo, tama. Oo.
Hindi pa ready yan. Kasi siguro ang iba dyan, around that age, had their menses, right? So, yung iba nagdadalaga na, yung iba wala. And these kids, 9-year-old, where do you normally see them? Schools, playing.
Correct.
And then, that girl becomes pregnant. Physically, it has an impact. Second, that is still a kid, a girl, a child. Wala pang alam. Right? Wala pa siyang alam. So, how can she decide on her own? Right? We don't know kung nabuntis siya ay nagpe-play pa, and then nakukunan siya and all. So, that's another factor there. Third, mental. Hindi siya aware that you are carrying a child with you. You have to take care
Correct.
of you and your fetus. Right? And nutritionally, may imbalance dyan kasi that child, 9-year-old, is still actually developing. So, ang nutritional niya na intake, mag-aaway yon sa both kulang na sa mama, kulang pa sa bata. Tendencies, pag these are born, delivered, normally these are either stunted, wasted, maliliit, no? May impact siya sa bata, may consequence. Ang iba naman ay born na 7 months or earlier, mga premature.
Correct.
So that's it. Mental. Emotional. So these kids, 9-year-old, less than 15 when they're pregnant, we don't know who did impregnated them. The normal, isa pa yan, no? Yeah, hindi natin alam rin, no? It's a good study to do, no? Na ano ang basis nito, bakit na pregnant at the age of 9-year-old. So, pwede titingnan natin na pag 9-year-old, pag gano'n, no? Pregnant siya, wala siyang idea, how do I take care of myself? How do I decide? So, ang tendency, there is a huge possibility kasi hindi niya alam, hindi siya aware. Nakunan siya, no? At the risk of the mother, the girl mother, and the baby, the fetus. So these are the kind of things that we need to consider sa impact ng pregnancy especially among 15 and below.
How will it affect your future? Kung ikaw mismo, di ba? I mean, you are the adolescent. Ikaw yung nabuntis. How will it affect your future? Mga pangarap mo, di ba? Mga gusto mo pang abutin when you are already a mother at that age.
Yeah. One of the interesting na study po ni Dr. Herin, no? One of the professors sa UPPI natin, which is also an attached of DepDev, which is nagbibigay rin sila ng researches at saka data in terms of Sinabi niya po na malaki ang how do you say that? Malaki po ang impact ng decrease in terms of opportunities sa batang babae na nagbuntis at hindi natapos ang pag-eskwela niya. Sinasabi niya, I would like to quote him because it's actually there. According to Dr. Hirin, sinabi niya, a teen mother who did not finish high school may earn about 46 pesos per day at the age of 20 compared to 361 per day for a woman who finished high school and delayed pregnancy. So that's socio-economic. Automatic, when you are an adolescent and you are going to school, the tendency would be, I would have to stop schooling. And I have to focus on childbearing, child rearing. Ganon. So hindi ako makapag-sabay sa kanila na nag-graduate na. Pag-graduate naman nila, ikaw naman, malaki na ang bata kasi you need until 5 years old to take care really of your child kasi that's part of the foundational development of the child. So after 5 years, ano mangyayari? Hindi ka pa natapos? Your other colleagues are already, nagtatrabaho na. And ikaw, it's already late for you. It's okay if you have, if there are those naman na talagang nag-continue.
Yeah.
Pero isa yon, the economic opportunity. That's one, no? What else? Ito rin ang study rin ni Dr. Hirin. And I would like to also emphasize also.
Eto, ma'am.
Yes po.
I wanna know, with these studies, are we also applying it sa
Yes.
CPD natin? Ginagamit ba natin siya?
Yes.
Yeah, for interventions.
Yes.
You made mention kanina na we have teen centers.
Yes.
Kompleto po ba sa lahat ng mga probinsya?
Yan ang very good question. We have teen centers in the region. And the concern there, the issue there is not all established teen centers are functional.
Nagagamit. Yun ang tanong.
Isa sa mga indicator kasi ng SGLG sa mga munisipyo natin, yung talagang establishment. So ang nangyayari, which is really what's happening in the field, pag meron tayong monitoring dito, nagiging ito. Parang ang nangyayari, parang naging compliant lang tayo.
Correct. May facility.
There is
pero
a facility.
Hindi operational.
It's not functional. That's
Yun.
where we wanted to really push further. We at the CPD, together with the Department of Health as well, kasi ang Department of Health sila po ay sa school-based, kami naman po ay sa community teen centers. Ang atin is talagang pinupush natin na these established centers should not only be there, but it should be functional. Because this would be a platform, an avenue for these adolescents to go and be referred to where they can discuss about, what's happening to them and their bodies.
Yes. Saan po tayo nagkukulang?
Yan. No? I think, I personally believe that it has something to do with the implementation. The Philippines has lots of laws already, Mr. Eman. Maraming magagandang, mga laws, but the problem is really more on implementation and enforcement. Kaya nga kami sa CPD, isa ito sa mandato natin. Although the establishment, the functionality of the teen centers would be managed at the level of the schools, or at the level of the LGU, sila na yon. Pero ang role talaga natin is not only monitoring, but really more on providing technical assistance to them. Ititrain natin yung mga counselors doon, mga teachers doon na nagbibigay ng services. So isa ito sa mandato namin. It's really purely technical assistance.
How much do you need to operate a teen center?
It's just
Gaano nga ba kalaki yung kailangan ng LGU when they want to operate a teen center? May ilan bang personnel na nandyan? Ano-ano pa bang mga kailanganing mga resources dyan? Paano po?
We had a proposal for Zamboanga del Sur. And I think, if I'm not mistaken, it's just less than million. But there is a structure there. I mean, there is an infra. Pero hindi necessary, Sir Emma, na talagang magpapatayo tayo a new construction for
Yes.
infra. Kung meron namang building, like in this case,
Existing na.
just have to plan for it kasi meron naman tayong checklist on what to place there. No?
Correct.
Mga audiovisual materials, necessary na mga, if you need, there is an installation of a TV and all for your IEC. Sa tao naman dapat train. Meron tayong either a guidance counselor or a teacher or a social worker na magmamando, not necessarily marami. Importante lang that these teen centers will be always open to the public whenever there is a need for these adolescents to be there. Second, you need to also establish referral center. Kasi pagdating mo naman doon, may problema ang bata. Mental health pala ang problema ng bata. So, i-refer mo siya directly where? Psychiatrist to the other health facilities. So, it's not only the establishment and functionality, but making sure the referral system, the service delivery network of that area should also be there para matulungan ang bata. No? So as I've said, we have a number of community teen centers in our region. Unfortunately, not all are established as functional. So isa ito sa ating pagkatutukan.
Meron tayong specific na province na tinututukan ngayon. Na-mention nyo kasi kanina, 2 provinces yung may medyo mataas.
Yeah.
Yung natin cases of teen pregnancy. We have Zamboanga del Norte and we have Zamboanga del Sur.
Yes.
Bumaba yung sa Zamboanga Sibugay. That's good thing, no? For Zamboanga Sibugay. Ano yung mga interventions when you met with Governor Uy and probably dito din sa
Zamboanga del Sur.
Ano po yung intervention na pinopropose po nila and then binibigay din ninyo po for
Yes, that's a very interesting question. When we had our courtesy visits with these local government leaders,
Yes.
we discussed about how we can enhance our capacity as LGUs because they are the ones implementing these adolescent health program at the local level. So isa sa nakikita natin yung kailangan na meron tayong maitayo kung na teen centers. So there were discussions about putting up of a provincial teen centers both in Zamboanga del Sur. Governor Divina was very
Yes.
and she really prepared a plan, a proposal that we already reviewed, and it costs millions kasi maraming programa yon. Pero ang point natin, maganda pag ang kausap natin ng mga leaders are very dynamic and they listen to us and they look at the data and they use of the data as evidence-based. So when we told them na ganito po, dumarami. So anong gagawin? Isa sa mga intervention ay ito para meron kayong referral. May papuntahan ang ating mga adolescents. Where can they get this exact information we're talking about? Mga counselors that are actually providing services, mga social workers at health workers na nandun dito sa teen centers. Pwede natin gamitin ito as a platform. And they really were convinced when we talked with them. And that's one, the proposal we prepared for Zamboanga del Sur. And another one when we talked with Governor Darrell of Zamboanga del Norte, maganda rin yung namin. So there's also a plan to come up with a provincial teen center. And si Governor Darrell naman, ang maganda sa kanya kasi he also established during that time yung sa Dipolog na ISDN natin. So sabi ko sa kanya, baka pwedeng gamitin yon as to replicate in the province. Kasi meron ng sample eh.
Yeah.
So that's a good intervention. I mean to say, we at the CPD, we are just there to provide possibilities, to give them data, this quality data, to provide possible intervention, to support them and capacitate them. But really, it's really their role to do this at their level, to come up with their own programs in alignment to our program as well. To make sure na itong mga programa ng gobyerno ay it's actually running at the local level.
Now, specifically kasi under the leadership, no, the administration of our President Bongbong Marcos, meron bang specific na programa ngayon si CPD, no, as an intervention to these issues, especially on teen pregnancy po?
Okay. Prior to specific tayo,
Yes.
we'll go at the national level. The Commission on Population and Development does have this national blueprint framework on how framework ito. It's a 2023 to 2028.
Okay.
This is a framework, it's a national framework about how we integrate population and development issues and concerns to the localities. Kasi nga, no, because of the full devolution, makikita mo that we are limited. The CPD is limited towards policy making, coordination, and all. So yun lang ang magagawa namin.
Yes.
The one steering and implementing that would be the LGU. So isa ito. Itong PPD-POA or the Philippine Population Plan for Action,
Yeah.
PPD-POA, ito po ay naplano na framework, national framework ni CPD from 2023 to 2028, ay ito po ay merong 8 strategiya. No? But I will not dwell too much on the different strategies. We focus on the strategy for the teenage pregnancy or the adolescent health. Isang strategy ito or action ito, yung pag-strengthen natin sa interventions in the reduction of our adolescent pregnancies, at the same time to mainstream the adolescent programs at the level of the local government units. Hence, our role as part of the mandate of CPD is to identify our local leaders, our counselors, service providers, the teachers, na kakailanganin naming i-capacity to provide various programs. For example, mag-implement tayo ng U4U. We are providing training to them, different na mga identified na mga people at saka groups. Meron rin tayong enhanced usapan, no, na parang tinitrain natin sila, yung mga adolescents natin, in making sure that they come up with informed choice, and at the same time, they will provide inputs and advice to others as well. May it be men or women, no? Or lalaki o babae. Meron rin tayong shape, meron rin tayong iba't parenting talk wherein tinitrain natin ang mga LGU service providers na dapat kailangang mag-usap si nanay at ang batang nanay na nabuntis. Para malaman naman na there is a communication gap, we have to address that. Kasi kung hindi nag-uusap sa bahay, sila ang nangyayari sa bata, especially if that kid or the adolescent is already pregnant, marami siyang magagawa. No? Like, pwede siyang ma-ostracize from the community, from the family, pwedeng mental health, pwedeng depression, and worst, baka they will have to take their lives, right? Which is not good, and we're not advocating to that. So, importante na pag-usapan. No? That's why we're focused on building capacities among teachers, among guidance counselors, youth leaders.
Yes.
Youth leaders at that, the schools, in order for them to make sure that they also provide such kind of interventions among the youth. So hindi talaga si CPD ang nagbibigay or nagdadala ng programa down.
Yes.
We are just here to capacitate, we enable institutions to really make sure that we achieve sustainable development.
Is there a need for us to highlight sex education in schools?
Yes, that's what we call RHE or the reproductive health education.
Yes.
Nung una kasi that's, if I'm not mistaken, that's comprehensive sexual education, and I believe there were some discussions on how we can improve not only the nomenclature, the name.
Yes.
Because other sectors would say, no, that's not the way to go because,
maraming mga issues din, mga concerns.
Yes, that's very, very sensitive.
Yes.
So we actually modify that to become reproductive health education. And part of our role is we capacitate our teachers, our school educators, especially those manning the school-based teen centers, so that at their level, they can also provide interventions. Anong gagawin pag ganito?
Correct.
Okay? And then they can also refer. We have visited few, saan ba yun sa Zamboanga? Tatuan? Tatuan in Zamboanga. Very functional. New pa lang siya, but it's a functional teen center wherein the school in charge, the focal, she's already trained with the different trainings that we provided, and at the same time, she manages the team together with young adolescents na mga leaders rin.
Yes.
Na sila yung nagbibigay rin ng help, tulong sa mga batang katulad nila. And it's very, very active to the point that they can refer to PNP, to psychiatrists, yung mga may problema ng mga adolescents nila. Okay? So that's a good functional one. It was actually being visited by Basilan na DepEd kasi they wanted to benchmark. So that's a good thing. We wanted to replicate that. So that's one thing for us, no, in terms of our interventions. So, yes po.
Education, LGU, mga local leaders
Partnership natin.
Yeah, yun ang mga pinaka-importante.
Coordinative bodies, Sir
Yes.
Eman. CPD, Commission on Population and Development, is also sitting, no, part ng coordinative bodies ng Regional Development Council, kagaya ng RPTCC. Meron pa tayong the AHDTWG Technical Working Group, wherein we partner also with DOH and other line agencies. So
Yes.
nagbibigay talaga tayo, using that meeting as a platform. We always look into how we can contribute to make sure that we provide these adolescent-friendly facilities and services na talagang magagamit at maa-access ng mga tao, especially itong mga kabataan. Isa rin yung problem or issue on access. Kasi kung wala kang teen centers, wala kang school-based na centers, saan talaga pupunta sila? Walang mapuntahan.
Correct.
Right? So, importante, establish, functional, at ma-develop yung SDN, Service Delivery Network, in terms of referral. So, that's one thing we are focusing now. And to add to that, since that would be the primary focus now, ang CPD po ay every year meron kaming theme. Isa sa mga theme namin ngayon, I think the only one theme this year is on focus. So we were told to look into what's the pressing concern in the region. And we look into the concern on increasing teenage or adolescent pregnancies among below 15. We initially had a talk with TESDA. We initially had talk with DepEd and DOH on how we can come up with a sort of strategy or framework na mas palaliman pa natin yung implementasyon, no, para ma-reduce ito. So isa sa mga nakikita namin is this, aside from yung dinalabi natin sa mga provinces, establishment of teen centers, functional teen centers, isa rin itong pag-uusap pa with TESTA, which Director Bacatan has already agreed to, that we will provide a curriculum on adolescent health. Adolescent
Tech-voc
sexual
ba?
sa mga tech-voc natin.
Yes.
So ilalagay natin siya dito, but we are hitting the age group 15 to 19. These are mostly working na, no?
Yes.
At the same time, we're looking at how we can penetrate and navigate how to strengthen our collaboration with the Department of Education because of the school-age children, the below 15 years old. So part of that would be really establishing, aside from the school-based, capacitating these our educators, our counselors, and other interventions that perhaps Department of Health can also help us. Kasi nasa programa rin ng Department of Health ang adolescent and friendly facility. So those are the things that we're looking into. And I know it's still very, very new to discuss this to our audience, but in our last meeting with the team, we have initially discussed about coming up with a framework on how we can address. We're looking at a triumvirate of the three sectors or areas. We have parents, we have the institutions,
The community.
and the community. And at the center, at the heart of it all, would be the young adolescent. But we wanted na hindi lang siya recipient sa services natin, but he or she is also an active collaborator and is engaged with the rest of this triumvirate as we framework it to be, para hindi lang siya recipient. Siya ay may parang dynamic na participation in terms of these services.
This framework that you mentioned, no, community, mga institution natin, the parents.
Yes.
Kasi most of this itong sector na to parang external. Yung parents are internal. Parang they are really near, nandito sila malapit dun sa mga adolescents natin. Ano nga ba yung mga role ng mga parents? Ano ba yung role nila? Bakit? Para mapigilan, to encourage, to influence their children, yung mga adolescents natin, no, to really not do it, no? Huwag mag-engage para hindi mangyari ang teenage pregnancy.
That's a very good question, Sir Eman. Importante ang pamilya. As we know it, even in college, sinasabi that family is the foundation, the basic unit talaga of the society natin. So it's the foundation where we have to develop our values, our norms, our ethics, our behaviors. So if you as a parent will be the type of parent that you open it up to your kids.
Open for discussion, no?
Open for discussion. I mean, in my case, I do that with my 10-year-old, 12 years old. May babae ako, second po, 6 years old. So we keep on really informing them. You take care of your bodies. You don't let anyone touch you in any parts without your consent. At an early age, graders ito. Yan talaga. Because it's very important for them to be aware.
Yes.
Na, this is my private part, and this private part is only for me and I alone. So if I will not, if I will not allow anyone to touch me in anywhere that, in any parts of my body, then wala kayong dyan. So isa ito, the privacy. The privacy of yourself, your body, and at the same time, the delineation and the demarcation when you are parang crossing the line. If you are already towards, parang kung ikaw, meron kang plan for anything at all to these kids or children, alam mo at aware ka at the very young age. That's another way of doing communication. Second is to make sure that an open line communication between you and your kids, including your husband.
Kasama
Including
dapat
talaga si husband.
Kasi ang nangyayari, di ba? Parang si wife lang din.
Oo.
So parang it's the role of the wife to, to educate the children, pero hindi.
So dapat it's a dual role. It's the wife would be towards, or the mother would be, telling the girls, this is how to behave, this is how to like this, that is not good when you do this in public. Those are the kinds of things that you can say to them at an early age. Ang papa naman, the father, would also do that to the lalaki, anak nila, lalaki, son. So perhaps our society right now, we are Filipino tradition. So hindi pa open ng ating mind na the use of contraceptives, because we are pursuing that to be only used when you are already in cohabitation, especially in marriage, right? That's I know that's part of our tradition as a Filipino, especially na tayo we're living in a Christian Catholic society. So, ang atin lang is that what we are pursuing at the CPD is that you can only do so in terms of informed choice and voluntarism, especially when you are already like pregnant and you are an adolescent. If you are pregnant, you're adolescent, and perhaps you're getting married, you're planning to get married, or you're already married, of course, you have to make sure that these are all planned. No? Ano ba ang mga contraceptions na pwede mong gamitin? So we have lots.
Yes.
For boys, we have condoms. Kung wala namang plan for vasectomy, the girls also have. Marami tayo. So these are possible things that you can actually provide information. You as a parent to your adolescents.
Yan ay kung agree ka.
Yes
with,
po.
Yun kasi may mga sensitive
talaga
yes,
yan.
it's a very sensitive topic kasi, especially when you talk about the parents. So,
yeah.
Pag yun, actually I was thinking while you were discussing po, Director, na would it be easier to educate the parents first before their children? Kasi nga, 'di ba? They are, yun nga sinasabi natin, mas malapit sila sa mga magulang nila. They believe more their parents.
True.
So, if we educate more, would it be more effective sa ating kampanya, no, against teenage pregnancy to educate first the parents, no, before the children?
Yes, that's the reason why we do have this initiative, the one I mentioned about the parenting talk. Wherein we really, the local government units, because we are already providing them
Yes.
the capacity, the training on how to do it. So these service providers, counselors, social workers, are the ones managing that at the level of the local government. And isa sa mga talagang pinagtutuunan nilang pansin, itong pag-uusap between the parent and of course the child. So it has to undergo a process wherein the parents are, parang given discussion on this, orientation on this,
yes,
until at the end of that, yung dalawa na po ang mag-uusap. So it's a good platform and avenue. It's a good intervention. Kung hindi man sila nag-uusap sa bahay, dito, pwede silang mag-usap. That's also a good one. But to add to that, aside from, of course, our role as parents, yung pag-uusapan natin, and if you're bound, if you are a Christian believer or Catholic believer, of course,
Yun nga.
it's always being part of the lectures and even in the discussions in the church that you never have to engage.
Yes.
Ganun naman talaga eh. You never have to engage. However, if also you are a liberate thinker, which marami na rin sa atin, because not all are Christians here, marami rin sa atin na mga parents na talagang nagbibigay ng mga, the ABCs. No, the basics of, are you going to engage this early? Or do you want to, have it first, develop yourself first, capacitate yourself first, finish your schooling first, get a job first, be mature enough first before engaging. So this is basically two ways in which a parent can look into how the parent could help support the child. So the CPD and the rest of the agencies sa gobyerno, kaklaruhin ko lang po ito, we are not saying it's a no-no. Nobody can say that. It's not a no-no. We are only telling everybody and informing everyone, the parents and our adolescents, that we need to be able to be aware of ourselves, our bodies, to be able to formally decide on ourselves, to be able to be productive first, to be able to capacitate ourselves first, to educate ourselves first before we engage into sexual activity. So we are therefore advocating for delaying. It's delaying sexual activities among adolescents. That's why other LGUs do have other programs for adolescents, mga sports. Because ang point nila, perhaps we can make them busy with other areas. Kasi kung hindi siya maging busy at hindi siya nagsuschooling, wala siyang peers dito, ganito, baka the focus of the adolescent will be going towards engaging early initiation of our sexual activities.
Doon sa dalawang sinabi po niyo yung option na
Yes.
dapat gawin, that the parent should think about, saan po ba sa tingin niyo ang most effective? Na-mention nyo naman, after na si CPD talaga is no, you go for delaying. Pero yung sa dalawa, na dapat gawin ng mga parents, saan ang mas epektibo?
Para sa akin, because it's a personal,
Yeah, of course.
it's a personal thing because I don't have yet, I need to read yet a study or research about this kind of parenting. But for me, having a liberate minded liberal mindset, I would rather that my kids would hear it coming from me than the peers would tell them about, sexual education.
Yeah.
And for me, to be very, very frank with you, Sir Eman, I don't name private parts with any other nomenclature.
Yeah, mga flowers.
Flowers.
Or,
I do name it as it is without malice. Kasi sometimes it's the way you deliver that has malice. Right? So if you say ganito, please, ganito, pag married couple ka na, meron ka ng that's normal. It's human need to have sex. Ganito lang ang pag-uusap nyo. You don't need to, really elaborate that. So, with that, at first, ata my son was quiet, a little bit surprised when I talk about sex. Just the word sex. But later on, parang na-accept na niya that, and it has no malice at all. That is actually one way of doing things. You have to be honest. You have to make sure that you don't over-explain nor under-explain it. Because the tendency of our young children, if they don't know the answer, where do they go? Peers, YouTube, and peer pressure starts.
Has there been a study na ginawa regarding po ganyan na yung instead of calling it what it is, pinapangalanan ng iba, meron bang mga study about that?
Yan ang gusto nating
may negative siya na
makita.
impact.
But if I'm not mistaken, I've heard it from one of our developmental pedias in the past that especially in the developing minds of the children, kasi I was once a teacher, talagang kailangan mo silang, kasi these children are just like sponges. No? Talagang lahat ng sinasabi, they absorb. So, when you talk to them in a manner na no malice, you talk about white is white, black is black, something like that, in a way na talagang i-explain mo sa kanila that, your mama and papa are doing that, but you do that when you get married. It will eventually be part of their human nature that they will not be either surprised or perhaps parang aghast that parang ganun, So ang point ko that it is important that as parents as we are, we have to inform them of what will happen if you will get pregnant, if you initiate early sexual activities. What is the impact and consequences to them and the result? I, for one, would always make an advice to my young son, 12 years old. Sabi ko, it's okay to have crushes. It's okay. And when you proceed towards teenager na, by 13, teen na siya, no? So, that's normal, and sometimes pag may development na sa'yo, there will already be some, you can feel that, the changes in your body and all. Pero don't forget that it is important that when you talk about sex, it should always be in the prelude that you do it within the bounds of marriage. And that's what I tell them. So it starts from us talaga. It starts from us being the teachers of our children.
Yeah.
That's it.
Director, napahaba na yung discussion talaga. Napasarap yung discussion natin regarding this kasi naman very interesting naman din talaga and existing talaga as an issue sa ating lugar, no. Yun nga na-mention niyo kanina yung mga data natin. Now, if ever a parent, or an adolescent would want to be counseled regarding this, kanino po sila dapat lumapit? Na-mention nyo kasi may mga teen centers.
Yes.
Pero 24/7 ba? Makakalapit ba sila? Do we have hotline numbers for this? Please po.
Our teen centers, community teen centers and adolescent centers are actually in the community. So meron tayo, you can go to our population development office to be referred to. Meron rin tayong school-based. So sa school, kung kailan siya nag-open, yun rin ang office hours ng school. But in the community teen centers, normally may may mga assignment dyan na sinong magmamanage. It can be young adolescents. It can be counselors. It can be anyone, social workers in the community. So if ever they want to know a lot, to increase their knowledge and to be able to converse with other young adolescents and about sexuality, about their ever-changing body, about their feelings, etc., you can always go to community centers. For community, we also have school-based for the school. Now, if ever there are also ways in which you can reach out. Kung hindi nila alam saan ang teen centers natin,
Yes.
they can always go to any health center. A health center in any barangay. Marami yan, no? Mga rural, mga barangay. So that they can be referred to any available health center in that area. Total, the health center also provide these services. And perhaps if they are not able to provide, so they can refer that to our teen centers naman, na mga established na.
Okay. Last from me po, kasi since we are already Hearts Month na po, no?
Yeah.
Valentine's Day, soon i-celebrate na. Ano po yung mensahe ninyo para sa mga kabataan?
Yeah, so mga kabataan, ito very, very important because of the increasing trend in our adolescent pregnancy, especially below 15 years old. So very, very important for you that before you engage into any sexual activities, because you're very in love, you have a crush, you have a boyfriend, you have a girlfriend, it's very, very important to think of yourself first. A question there is, are you ready? Are you ready? Ready in terms of physical, are you ready? That eventual, early initiation would result to pregnancy, especially unwanted pregnancy. Right? The second, are you ready for the consequences to bear the child and to raise a child when you are still very young? Are you ready to face the consequences that when you become pregnant as a young adolescent, a young mother at that, you will have to stop schooling and set aside your opportunities and your dreams for the future because of this unplanned initiation. So these are the things that you have to, to struggle and discuss within yourselves. No, pag-usapan mo sa sarili mo, para siyang soliloquy, you're talking to yourself. Is this correct? Is this the way my parents wanted me to be? Is this the way to go? Because if you think and you're sane enough to think because of your faith, because of the teachings of your parents and your peers, that this is not the right way to go, then you go ahead and proceed. And you stop. And you say, pause for a while and say no. You have to say no. What will happen? Of course, urges will just be just there momentarily. But the consequences of raising a child na pwedeng meron siyang sakit, pwede siyang magiging premature, a tendency that you're not yet ready, you and your child will be magiging, at risk, vulnerable sa time na iyon. It's not worth it. That's why you think first, and to be able to do such, you have to pray as well if your decision is correct. And don't be fooled by peer pressure. Peer pressure will always be there, but it will be you who will actually struggle for the effect of these decisions. So, capacitate yourself, educate yourself, continue learning, make it sure that you can be old enough to decide that you are on your own. And that's the time that by delaying your initiation of sexual activities, then you are already parang bulletproofing yourself towards a very, very good future. And we need people like you because sino ba ang future ng country? Di ba mga kabataan? That's why it's very, very important. Don't go with the urges. Just make sure that you have it all planned out and make it sure that you really thought of it to make sure that you delay your any plans for sexual initiatives or activities. I think that's all.
Thank you so much,
Sir
no?
Eman.
Director Little.
Yes.
Hopefully may mga nakuha yung mga viewers natin. Sa dami naman ng sinabi ni Director Little. Pero yun nga, baka meron pa kayong nakalimutan before we let you go, no? Kasi matagal-tagal, mahaba-haba pa din ulit na time, baka next niyong pag-guest sa ating
Yeah.
Kapihan. So you might have some more reminders
Yeah.
or announcements para sa ating mga viewers and listeners po.
Thank you so much, Sir Eman. Actually, but this February, this month, we are celebrating the 57th Commission on Population and Development anniversary. So, it would be the 57th because the Commission on Population and Development was established under Executive Order number 171 on February 19, 1969. So marami po kaming activities but mostly at the level of the national. Pupunta po kami doon, may mga activities, partnership meetings. So we would like to take this opportunity to also invite our partners and stakeholders to be a part of our activity, especially during our partnership meeting during the 57th CPD anniversary. At also, we would like to also use this platform, Sir Emma, no, to
Yes,
also
go ahead.
thank our population and development offices. Mayroon tayong mga PopDev officers per region, per municipality yan. Pero ang iba lang, hindi pa complete, hindi pa talaga like fully structured ang kanilang offices. We really wanted to thank our partners, our local government units, and our PopDev offices for making sure that whatever CPD is asking from you and supporting you in a way, you are the ones transforming it and streamlining it and integrating these plans in the field. And that's the most important thing, that you own these programs. We have varied programs. We have the adolescent health programs. We have also programs for our community centers. We have also some other programs for migration database. So lahat ng ito ay sila po sa mga population and development officers ang nag-i-implement sa field. So we thank you and our partners, the different local government units, for always supporting us in our framework, in our strategy towards PPD POA, towards sustainable development. Of course, we would like to thank PIA for making this avenue, Ardy Naomi, Sir Eman, and the rest of the team for having this avenue for us to be able to advocate our programs and projects.
Thank you so much, no? Maraming salamat. Director Leticia Dolores II, C. Abao, the Regional Director of the Commission on Population and Development Regional Office 9. Maraming salamat. Until your next guesting dito sa Kapihan sa Rehiyon, Nueve. At din pong pasasalamat sa mga sumubaybay at tumutok sa ating episode ngayong araw. Sa ngalan po ng PCO Secretary Dave Gomez, PIA Director General Catherine Chloe De Castro, Regional Head Noemi Edaga, at sa buong puwersa po ng Philippine Information Agency Region 9, at sa ating guest mula po sa CPD Regional Office 9, hanggang sa susunod na mga episodes ng Kapihan sa Rehiyon 9, ito po si Emmanuel Taghoy. Daghang salamat.